All right. We're going to start off with artificial intelligence in hematology. So, like I said, it's a brief review. All right. Okay. So, what is artificial intelligence and its potential in healthcare, particularly in hematology? I think its potential in healthcare is tremendous, tremendous, tremendous. Artificial intelligence in hematology would highlight how AI is being used to analyze blood cell morphology, interpret flow cytometry data, identify rare blood cell populations, predict disease progression, and assist in diagnosis of hematologic disorders. All this is done by the machine, really. Ultimately, improving the accuracy and efficiency of hematology testing with potential applications in areas like leukemia classification, myelodysplastic syndromes, and bleeding disorders. Okay, so in fact, Sandhya, you know Parag, ne? Parag Talwekar?
Yes, ma'am.
Yeah, so I think Parag has told me that he would, because he was in digital hematology, right? His slides. He
Correct.
Parag Talwekar,
Taukar.
yeah. And
Yeah.
he's told me, says, ma'am, if definitely you tell me, I'll come in. I think that should be interesting. Okay?
Yeah. We can call it.
Yeah. All right. So from the microscope to the digital images and diagnosis. So can you see the first picture up there? Parag has tons and tons of this stuff. Okay, single cell images. And he was a very popular presenter at Horiba, and Horiba did very well with him. So you've got uh, images, ML image based on segmentation. You're cutting the slides. You've got this microscope. You've got the cell picture. You have the DL based model. These are all models in AI. Extraction of morphological features associated with genetic aberrations. So here what AI does is it extracts what is present in the cell, which you and I can't do looking at a flat slide, right? So expert evaluation is by ML based data integration, clinical and data and genetic data. And then again you have the whole presentation of slides. And I think Parag would be the right person to talk to you on this call. We've called him in Sophia some years back, and he comes. I think he used to come to Nagpur at least once in 2 months. Okay, so you said blood cell morphology analysis, automated identification of abnormal blood cells, features using image analysis and algorithms, detection of subtle morphological changes indicative of disease like leukemia or myelodysplastic syndromes, improved accuracy and consistency in differential counts compared to manual microscopy. Now, see, you and I sitting with a slide under the microscope, we are not able to get into the depth of that slide, the depth of that cell. And AI helps you do that. It detects the very subtle morphological changes which can indicate disease, can point out to leukemia or any other syndromes. It improves accuracy and consistency in differential counts compared to manual microscopy. So you'll understand the manual microscopy is flat, one dimensional. Here it opens up a couple of dimensions, and working on the algorithms which are fitted in, it can tell you what could be wrong with the slide. Flow cytometry data interpretation. And I think the modern 6-part and 7-part analyzers have flow cytometry for further differentiation. So AI algorithms to analyze complex flow cytometry data for identifying rare cell populations. automated grading strategies for improved cell population identification and disease monitoring, support in diagnosing hematological malignancies by identifying specific immunophenotypes. So I think this is, as you can see, it is going into a whole another dimension which you and I were not aware of a few years ago. AI then gets into this and tells you what could be wrong and where. You agree? Looking at a flat slide, you can say, this is normal, abnormal, but what is abnormality? AI goes into the X factor to tell you what could be wrong. This is the way I look at it. Continuing, utilizing patient data and AI models to predict disease progression and potential complications. Risk stratification based on genetic and clinical parameters for personalized treatment plans. So again, like I said, we are exploring the other dimension in AI. So it can predict what can happen to this person and what are the complications, especially when we talk in terms of hematological diseases like leukemias and so on. So the risk stratification based on genetic and clinical parameters for personalized treatment plans. So it can also tell you if this is what you have, this is the sort of treatment you can give your patient. We never had that. Our doctors and our pathologists had to get back, refer to books, and then come to a conclusion by this is the matter and we need to do this. Okay? So hemostasis assessment, AI-powered analysis of platelet function tests for better diagnostics of bleeding disorders, identification of abnormal platelet morphology potentially associated with bleeding risk. So, Sandhya, you and I were talking about platelet function tests for better diagnosis of bleeding disorders. So this could be, you and I, we used to do mixing studies and do PT and PTT and take it from there. AI will help you do this faster.
Yeah.
Identification of abnormal platelet morphology potentially associated with bleeding risk. Now we could say, this was ये syndrome है कि Gaucher's disease है या von Willebrand है. AI will just deduct and tell you that this could be wrong and the bleeding risk is great or minimal. So the benefits of AI in hematology: increased diagnostic accuracy, faster turnaround time for test results, improved consistency and standardization across labs, and support of complex cases requiring expert interpretation. All this comes into play with AI. And can you imagine if we didn't have this, how did we proceed? We took a look at the slide and said this could be this, then we would call a special hematologist and then he would again refer and he would do his tests. He would talk to the others and maybe a few days later an interpretation comes through. Well, see, this is done in a jiffy. So it looks into challenges and considerations, data quality and availability for training AI models, need for robust validation and clinical trials, ethical concerns regarding data privacy and algorithm bias. So we'll go to the first one, challenges and considerations. Can you imagine when we were looking at a flat slide and we consulted X and Y and he did his tests and he said, this could be this could be that. Data quality and availability for training AI models. So once we had the data with us, the pathologist could use this data to train the juniors. Once a definite diagnosis was reached, then of course need for robust validation in clinical trials. So this comes through that we've got data, we've proved by examining X, Y, and Z tests, X, Y, and Z patients, 100, 200 test samples, and we've arrived at the diagnosis. So ethical concerns regarding data privacy and algorithm bias. So the data privacy is very important. So once everything is logged in and does it in a jiffy, we have to maintain the privacy. And the privacy is maintained by AI, which we could not in the past. People used to plagiarize data, plagiarize decisions, and take it as their own. And this helps you to get into further directions as to what is to be done next. Development of AI powered point of care devices for rapid hematological testing. So, Amana, here we go. AI has got this point of care devices for rapid hematological testing.
Yes.
Hmm? So that this is another big dimension in hematological testing. Integration of AI with other diagnostic modalities for comprehensive patient evaluation. So here we go. We saw one part of it. Now we are relating it to how to relate it to patient evaluation and what his diagnosis and treatment will be. Personalized medicine approaching utilizing AI to predict treatment responses. So this is one step further. We said, all right, a doctor says we're going to put you on this. AI also has data to say, if you put her on this, this is what can be the outcome. This is the way I am looking at it. We've got visual aids which are stored, images of normal and abnormal blood cell morphology. Here we go. Here we go. So a comparison is done by AI. Okay, whether this is normal or abnormal, and a diagnosis, it will give you the interpretation of what they're seeing. Flow cytometry plots demonstrating AI-assisted grading strategies. Sandhya, you want to elaborate a little on flow cytometry in these 5-part and 6-part machines?
Basically, ma'am, the memory in the machine allows them to store normal morphology,
Mm.
and anytime it comes across an abnormal finding in a cell,
Mm.
it will then compare it with the previous memory
Mm.
and then provide the probable diagnosis.
Diagnosis. Okay. Interesting. Graphical representation of AI-based disease prediction models. Again, so here it's got it in its memory. It will compare, like she was saying, and it can give you a diagnosis of sorts. Remember to tailor the content based on your audience, focusing on relevant applications and addressing any specific questions or concerns that might have regarding AI in hematology. So this is for the teacher. It says, remember to tailor the content based on your audience. So I've kept this very, very simple. I'm not going into too many details, but I think you have a fair idea as to the intelligence of these machines, as to what it can get into. I think somebody is coming. Is it? Just a second. Mahesh, okay. All right, maybe. Okay. So we're coming back. A graphical representation of AI-based disease prediction. Now this is so very important. Remember, it took us days and days, and my consultation 1, consultation 2, run here, run there. The AI will tell you what could be the prediction of disease in this patient. And like I said, I have kept this very, very simple. I'm not going into too many details. So it says, remember to tailor the content based on your audience, focusing on relevant applications and addressing any specific questions or concerns they may have regarding AI in hematology. So let us see if we can get somebody else onto this also in a day or two, in a week or two. Artificial intelligence and hematologic diagnosis, of course, is a game changer. Remember, I'm repeating myself. You got a fact slide, you have a machine, you have results, and then you went into X, Y, and Z, you consulted, and you wasted days. Here, this baby can give you a diagnosis in a jiffy. In hematology, AI-based methods have been applied to automatically detect and classify single-cell images or superordinate patterns. So the brain is there to compare, contrast, and give you a diagnosis. I think Sandhya said that this is what the machine also remembers when we talk in terms of flow cytometry. Artificial intelligence and its applications in digital. For medical images, intelligent recognition by learning a lot of medical images. AI can help doctors locate the lesion area and help detect the lesion, facilitating diagnosis. And this is what is taught to the student. The student pathologist, lots and lots of images, and this is what Parag used to bring for us in Nagpur, and the student was made to study the images, and they were given a test to locate if something was wrong or malignant, and they had to give a diagnosis. AI can help doctors locate the lesion area and help detect the lesion, facilitating the diagnosis. So if you were to take a look at the picture below, it says deep listening, learning to machine learning to artificial intelligence. This is the way we have progressed. Okay. Can you read the finer print? In deep learning, what does it say? Guys, can you read it yourself? Algorithm?
No, ma'am.
Very tiny. Let's see if we can pick it up.
No, ma'am, it's quite blurred.
Anyway, let's see if we have it on. You got it on your. Mustafa is trying to get it on his mobile. Any luck?
I think it says
It becomes
algorithm
blurred.
that makes human
It
brain
becomes
to
blurred.
recognize.
It becomes blurred. Once we enlarge it, it becomes blurred.
Algorithms?
Algorithms, yeah.
No.
That make human brain to
Mm.
recognize. I can't read the word after that.
It's okay, all right. Maybe you'll be able to read it on your PPT, right? Okay. So pathology AI reference guide. Pathology AI provides tissue data by analyzing images of histology slides using image analysis and machine learning. Since histology slide images are very large and processing can be quite complex, tissue image analysis needs to be performed at high performance computing data centers. So even in cytology and pathology, they have digital pathology now, digital histopathology. In fact, my nephew in America is the director of one such center there. He's in Gaithersburg, and he's asked after me, says, "Will you just come and spend some time with me and us?" And it is just fascinating. It's just mind-boggling. That is what he keeps telling me. So pathology AI provides tissue data by analyzing images of histology slides using image analysis and machine learning, right? Because all these are stored into the data, and what you're seeing under the microscope is compared to what they already have in their data bank. Since histology slide images are very large and processing can be quite complex, tissue image analysis needs to be performed at high performance computing data centers. And there are data centers, like I told you, America has quite a few. And there is one in Gaithersburg, which is supposed to be top of the line, and he's a director there. So, Parul, if you're that side, you can go visit him. I'll give you his name. He'll be thrilled to have you with him.
Where is it?
Gaithersburg in Maryland. In Maryland.
Yeah, I'm going to go to Virginia, so maybe if it's close by.
I will, yeah, because he stays in Maryland. In fact, my treaty is also there. And you know, Sandhya, you've given me an idea. 3T works for a center that deals in breathing and clotting time and high performance in you know, and maybe she can send a clip.
Yeah.
She's in a little off Baltimore, and my nephew is in Gaithersburg, and he's just last year he took over as director of this center. And in fact, I told Dr. Anita Borges, I said, Anita, would you like? She says, Luz, I'd love to. And she says, when I'm planning, I'll let you know. I'll go spend some time with him. So that is the way they've progressed. So pathologists versus artificial intelligence. Nice competition, right? So collaboration or competition. Pathologists agree on what they see in a tissue based on their expertise, all right? Many people think that an automated artificial intelligence system for pathology that archives a performance, that's achieved a performance of 90% outperforms pathologists, that's a question mark. But those pathologists are using microscopes and computational part that humans are not good at, would greatly benefit from the use of computers. So is that the right comparison? That's what I said. You and I sit on the slide, sit on the microscope, and our brains are our intelligence systems, and we compare what we are seeing. So, but the AI system, what does it say? It achieves a performance of 90% outperforms pathologists. But those pathologists are using microscopes and computational power that humans are not good at, would greatly benefit from use of computers. So is that the right comparison? So who wins? That's the question. We continue. The perfect intermediate step between manual microscopy and automated artificial intelligence is to provide pathologists with the right tools in form of pathology AI system described above, which as part of its normal workflow generates an abundance of free training data. Pathologists verified cell classification for the whole slide, for all slides, that can be used to train an automated artificial intelligence systems. Already the data is stored in the memory of the AI system, whilst the pathologist uses his human brain to classify and compare. Are you getting this? The advantages. As the performance increases with more training data, it becomes obvious when the time is right to commercialize an automated artificial intelligence system. Let's provide pathologists with the right tools. Replace the microscope, not the pathologist. Some may disagree. So this little tug of war is on all the time. So as the performance increases with more training data and AI has it in the store, it becomes obvious that the time is right to commercialize an automated artificial system. So let's provide the pathologist with the right tools. And this is the modern way of thinking. The older pathologists may not agree. We are asking the question, replace microscopes, not the pathologists. Some may disagree. So here you can see the hand, you've got the automated hand of the robot and you've got the human hand. What's next?
Conclusion.
Now this is the conclusion. AI applications can be used at all stages of patient management in hematology, from the diagnostic peripheral blood smears, blood analysis to gene profiling. AI is important for developing individual specific treatments. Many studies on leukemia classification, stem cell treatments, and genetic programs also continue. As a result, artificial intelligence systems will be used much more in the future than it is now. Models of hematological data supported by intelligent systems will set the stage for us to better understand diseases and develop new treatments. So, this is what we've been talking about in the last 10-15 minutes. AI applications can be used at all stages of patient management in hematology, from diagnostic of peripheral blood analyses to gene profiling. Right? Previously, we had the smear, we had the genetic marker, we consulted X, Y, and Z, and then maybe we arrived at a diagnosis. But with AI, we arrive at this diagnosis very, very fast. So the studies of leukemia classification, stem cell treatments, and genetic programs also continue. As a result of artificial intelligence systems, will be used much more in the future than it is now. Models of hematological data supported by intelligent systems will set the stage for us for better to understand the disease and develop the treatments. So this is what it's all about. So let's hope that AI is AI, and I don't think it will ever replace the human system. This is the way I look at it. Some of these bits I've taken from these authors. Artificial Intelligence Applications in Hematology. These are the authors. The University of Health Sciences, Bursa, Training and Research Hospital, Department of Pediatric Hematology. Oncology is coming from Turkey. A lot of stuff has come from Turkey. Two University of Health Sciences, Kesikron Training and Research Hospital, Departments of Pediatrics in Ankara, Turkey. Hello? Who's speaking? Oh, Gautam Bhai has come. Gautam Bhai. Okay. Somebody was speaking.
No, no, it's okay, it's okay.
Gautam Bhai, mute. I think you should move mute.
To my daughter who is.
That's okay. That's okay. All right. So this is what artificial intelligence is all about, guys. And I think it has a fantastic future. Has a fantastic future, and we must acknowledge that it is there. But I also have to tell you that I would say that the human system is equally important. Because we don't want robots replacing us in the very near future. It may just happen. Any questions?
And there could be an error, no? Like sometimes if the machine is not working properly or something, so some troubleshooting and all, so that part will have to be looked into. No? So the results are accurate. But sometimes the machine it is giving some problem.
I think that the algorithms that are stored into the machine, Beena, is they're pretty good. And I think they flag errors, if I'm not mistaken.
Okay.
They will flag errors. Sandhya, anybody familiar with this?
Yes, ma'am.
Because your machines also flag errors, right? An abnormal result, they will flag. So I'm sure, unless a very bombastic definition or diagnosis is given, I'm sure correction will be made. It's possible.
For the system that we have used, the Wala.
Little louder, Sandhya, little louder, please.
I hope I'm audible now. So basically there is a calibration slide that is provided.
Mm-hmm.
But if the system is calibrated with the help of this calibration slide,
Mm-hmm.
it is looking at specific cells and storing it in the memory of the machine.
Correct.
After that, whatever sample is being run, it is being compared with correct cell or a correct abnormal cell, you can store it in the memory of the machine, and then later on, having that in the system, it will then compare all the samples that are being run year after with that abnormal slide or cell,
Cell.
provide the user with the information on the new cells that it is finding or identifying as abnormal.
Okay. Okay.
There are some parameters also that work as quality control. In fact, MCHC that we have been using in QC happens to be one of the most stable parameters that can be used for the comparison. That is a form of AI, I think. Not only that, some parameters that instruments are introducing recently are also a part of the AI or the information collected from various scatter plots and compared with the normal. Only then the instrument will give you a new parameter, which is a result of the AI or the algorithm that has been set in the machine.
Okay. Makes sense. That's the way AI also works, right? It's got so much of stored data and algorithms for comparison, and then it arrives at a certain diagnosis and gives it to us.
Yes.
And we are talking about millions and millions of these, are not 1 or 2 or 10. This is what it has stored in its memory.
Minimum is 10,000 images that it will use for single comparison.
Wow.
Minimum.
Wow. Wow. Any other questions? Okay, then I think we can end at this stage. I have a feeling, Sandhya, since we've had this lecture, maybe I'll ask Parag
Yeah.
if he will come over, and maybe we will keep the lecture free for anybody who wants to attend.
Ma'am, when do you want to invite him?
Let me ask him. He's in Bangalore.
Yeah.
He's in Bangalore.
Okay.
And he's told me a couple of times, just let me know and I will come. And I know the slides and all he has are just fantastic, because we used to give it to our students, and we used to have these training programs of different people. So we used to put it on at that time, and it's really, in fact, Jaldeep was telling me, be sure to call Parag over for this. So maybe we can have a free lecture if Parag is willing to do it.
Yeah. I'm sure he will.
Mm. What do you say, guys? Would you like to take a look at what he has? Because those slides are mind-boggling. Chalega?
Yes, ma'am. Yes, ma'am. Ma'am, it must be correcting for like hemolysis and lipemic samples and all.
I think machines do. All machines have this trigger. Right, Sandhya? All machines have, especially all of them have triggers for hemolysis. Am I right?
Simplest analyzers are using technology which is AI based. That's why they can give you 75, 80 parameters in 1 minute.
Mm. Any other questions? Because we've got you have something which troubled you in your quiz. MCQs.
Ma'am, I couldn't answer the leukemia because I didn't get time.
What number? What number?
Oh, ma'am, all those questions I couldn't attend.
Because we've got the asterisk. The asterisk shows the right answer.
Yes, yes, yeah. But like I attempted doing it on my own, but I couldn't do those. The leukemia one. So.
Number to bolo na. There is an answer number
Yes,
yaar.
yes, ma'am, I'm just seeing. One second, sorry.
Anybody else?
Ma'am, like question 19 and
Chronic lymphatic leukemia is defined as.
yes, that and ma'am, that hemolysis in PNH and DIC, so that coagulation. Those some few questions on that.
But the answers are in front of you.
Yes, answers are there. Yes, ma'am. I couldn't attempt on my own, like that is it.
Anybody else? Anybody has a score?
Ma'am, the MCQ ones were easy, pretty straightforward. But the calculation one, like the 21st one question, where MCHC and the hematocrit and all that is given, and you have to calculate the MCHC. So yeah, I was kind of lost with that formula or how do I calculate that.
Yeah, but you must know the formula, no, of each.
Because
MCH का formula क्या है? Hemoglobin upon red cell into 10. MCV is PCV upon RBC upon into 10. And MCHC is hemoglobin upon PCV into 100.
100.
And you must know the normals. And depending on that, you can say this normochromic normocytic or hypochromic microcytic and so on. See, I asked you a very basic question right in the beginning. And I ask most people when they come to join the lab that if the red cell count is 5 million and the hemoglobin is 8 or 9 grams, what is the matter? Is this anemia? Is this anomaly? What is it? Remember when I was presenting those introduction to hematology, etc., and I asked this question. Some can answer, some don't. It's a hypochromic microcytic anemia, and usually people with Thal minors have a picture like this.
Yes, yes.
So you must know your formulas. That's important. Anybody else? So the answers are there in front of you. If you don't agree with an answer, let us know. Because phlebotomy MCQ is from DCA. It's from DCA. Okay? A little bit help from Dinesh, my boy, who's in Nagpur and has done his Skill India thing. And hematology is a mix of DCA as well as Nagpur, as well as some things we picked up from the ASCP books. So you've got the answers in front of you. Keep them in front of you and go over it. Did it help? Did these MCQs help?
Yes, ma'am.
Yes,
Oh,
ma'am.
were they very
Yeah.
funny?
It really helped.
It did help.
It did.
Gautam bhai, you saw the paper?
Yeah, so far fine.
You solved many? You could do
So
it?
far,
Huh?
not a single
Why?
answer.
Your daughter couldn't help you?
I could not get you.
I said your daughter didn't help you?
No. Now she is in the brain science. Because
Okay. Mahesh, did you attend the MCQs? Did you attempt? Mahesh, are you hearing me? He's around, no?
Yeah,
Mahesh, unmute. Unmute. Nah, Mahesh is pretty good at this because he's a regular person who works on the hematology machine. Mahesh,
हाँ एक मिनट भाई
हाँ.
झाले की नाही
लेकिन I, you pay attention here.
हॅलो
हाँ.
हाँ मैडम
I said,
Yes,
did you take a look at the quizzes? Quiz देखी आपने?
मैम देखा है मैम और एक बार देखना पड़ेगा मुझे
Give it to your text ना.
ओके ओके
उनको पूछो.
जी
Teach them.
यस
Because Mahesh is a pretty good tech, you know. He knows exactly how to work his machines and everything. Where are you, Badlapur? Or your home?
यस
Okay. Anybody else? Anybody else? Any other questions? So what I'll do is I'll ask Parag if he's willing to come over before we start those 5-6 other lectures. Okay? And those of you who are interested in those lectures, we'll give you the list again. I'll tell Murira to log it down. She's not on today. I think maybe something in the family. And you all decide if you all would like to come into this, because these are interesting. Like these are immunochemistry. Okay, so the mixture of immunology and chemistry.
Ma'am, in the phlebotomy questionnaire, there was again question number 21. I found it a bit confusing because normally when we collect blood, we keep it at room temperature. If it's an SST for it to settle in the gel form, and otherwise also, even ABGs and all, we keep it at least for half an hour. But over there, the correct answer says a cold location. 2 to 5
What number? That has no number, is it?
21.
In phlebotomy?
Yeah. It says it is imperative that samples collected be stored in a cold location away from light between 2 to 5 degrees.
Yeah, this is especially related to our country. And in New Zealand, you may not get into that, you know, because you know what we do over here is we expose the sample in the lab unnecessarily, and we advise that you if it's a clot, let it sit for about half an hour, 20 minutes, and then spin it.
Correct, but that when you keep it standing for that half an hour, you keep it at room temperature, right?
At room temperature, yes.
Yeah, but over here it says imperative that all collected samples go at a cold location.
But we prefer to keep it at, we have a 37 bar dry bath all the time, and when it comes in from either from the phlebotomy room or from the wards, we put it over there, a red stopper or yellow stopper, and then we spin it. EDTA I prefer that they log it in because we get the number and put it on the machine directly.
Okay.
And if it is to be transmitted when they go for visits, for us we're lucky the visits are very close by to the lab. Otherwise I prefer that they take an ice pack with him.
Yeah, we take ice pack for a rural clinic
Yeah.
and all.
Yeah.
But
They have these little
otherwise,
bags, thermocol bags, and they bring it on that.
Okay. That was my answer, which was wrong. Okay, thanks.
Because ABGs, are to be done immediately. ABGs, we don't have an ABG machine in our lab, but the PICU lab has an ABG. And we tell them, please quickly run it.
Yeah, it has to be done as soon as collected.
Yeah.
But then it is good at room temperature for 20 minutes, and if the case you feel to be delayed in running it, they recommend you keep it in the fridge at that time for an hour.
See, I tell you, when I was in college in America, at Duke as well as at Watts Hospital, we used to have ABGs used to come regularly, and we had a glass, we filled it with ice, and we put the tube in the ice, and we ran to the lab. The only other place in our hospital that had an ABG machine was in the OT,
Okay.
and one was in the ICU.
Right.
But this is the way we very quickly we ran with it and we processed it.
Thankfully, we have those Lamson tubes, so wherever you're sitting in the hospital, you can just set it in the Lamson tube, and within seconds it reaches the lab.
You've got the tubes. You've got the tubes.
Yes,
Yeah.
we've got the tube.
Yeah,
And
yeah.
we've got ABG, like blood gas analyzers and ICU in ED, as well as in...
No, but in our hospital only the PICU has the ABG machine, and in fact it's a gynac. It's a delivery place, so very rarely if the patient collapses we've had a problem. And now we have the ABG machine in the PICU. Otherwise, even I think most hospitals now have the tube system. Samples are put, and in fact I find South hospitals are very well equipped with this rather than our hospitals. Yeah, I look at it that way.
Right.
It comes via the vacuum tubes, suction.
Right. Okay. In fact, point of care has a lot of AI, but we encounter problems like, the preset data to the analyzer. At times it cannot pick up if your sodium, the QCs, if you look at the graph, you can pick up that the QC is running or it has a bias. But the patient samples at times it can get mixed. So we do a manual check as well as obviously what the analyzer is telling. And that's why we have
Mahesh,
to
just a moment.
For a lot of EQAs and RCPA values and comparisons.
Mahesh,
Point of view.
Mahesh, can you hearing me? Mahesh? What is your experience with ABG? We have an ABG machine in the lab, right? In Badlapur?
Yes, ma'am.
And how quickly do the samples come? कितने देर में आते हैं? The boys bring it, right?
30 minutes, ma'am. Yes, ma'am.
It stays okay? It stays okay? It does. I see the results. Only thing I get worried when I see 7.5 on the pH. And the O2 and carbon dioxide topsy-turvy. Mahesh has samples coming in for 3 to 4 different hospitals around.
Yes, ma'am.
And he's got a lot of CKD patients, he's got cardiac patients, and it's interesting. After I've come on, Mahesh, how many labs, how many hospitals have you picked up?
4, ma'am. 4 and 5 hospitals.
After I came on,
Yes.
and no complaints.
No complaint, ma'am. No complaints.
Correct.
प्लेट आता है वो भी फिर भी क्लॉट सैंपल होगा वो टाइम पे ही बाकी तो नहीं।
वो तो आया, तुम्हारा हाथ होता है ना कभी, you send it back for a recheck.
Yes, ma'am.
I think Dr. Ingole is quite pleased with the progress, so keep it up.
Okay, ma'am. Yes, ma'am.
Anybody else? Sandhya, you want to add in something?
No, ma'am, we would like the lecture by Parag, and then we look forward to listening to it.
Yeah, we'll get if Parag can come on quickly. Let's ask him, because I think he will be talking from Bangalore, right? And our lectures 6th, 7th that I want to present, I'll get back to you, and we'll talk about we are pricing it this time a little more than 999, but I think that's important, because let me tell you, I cannot do this without the help of my techs at Durgawala Hospital. Munira, here I have Mustafa, then there is Shagufta, there is Aisha, there is Noor, all of them pitch in. So I have to thank them a lot for what you have seen in the last 10 lectures. Because if they weren't there with me, I wouldn't be able to do it. Right from translating the PPTs into PDF forms, getting on to you, telling you things, I wouldn't be able to do it. I wouldn't be able to do it. because my PPTs are, some of them are from Roche, and some of them are from Horiba. But all these are my PPTs, so I have every right on them. Nobody can, it's no plagiarization. So, to convert it into RK Maudawala Inspector takes time. And Munira is very good at it. She does it very in a jiffy, And this presentation usually is done by Shagufta and Mustafa. Aisha and Noor help us with, Noor puts everything back on YouTube and Insta, and now we are also putting it on Facebook. Aisha is very good with the laptop and the computer and the what do you call it, mobile. So she knows exactly how to go about translating one from the other. So I have to thank them, because if I didn't have them, I wouldn't be able to do this.
Great team.
Yes, ma'am, it's a lot of effort. So I think, yes, you can charge whatever.
So
The 999 was less actually, ma'am. Compared to the effort you have made, ma'am, frankly. So,
and let me tell you, I haven't paid them a single penny. I haven't even given them a chocolate, for that matter.
and we would like to thank them.
Mustafa is here, he's sitting next to me. Shagufta is on, I think she's hearing. Shagufta, are you hearing?
Thank you all of you.
Yes, thank you.
Effort. Thank you so much.
It's so nice. Yes, I think it's been a good experience.
Shagufta, unmute. Shagufta, unmute. Hello. Is she on?
Yeah,
She's walked on, I know, but she's... Okay. Shagufta may be on the microscope, but I think her
phone, yeah, whether to be put on.
her phone is on, and all the others are listening in. Okie doke. I think can we stop here? And let me get back to you on Parag. And I will also tell you what, I told you what the lectures are more or less, but we will trim it and get back to you on it. And like I said, there will be a small charge for it, okay?
No issue, ma'am.
Yes, ma'am.
Ma'am,
Okay,
no problem whatsoever.
okay,
We are looking forward to it.
Yes, ma'am, I'll also come on.
okay.
Yes.
Thank you.
Okay.
Thank you.
you.
God bless.
Thank you, ma'am.
ma'am.
God bless.
Thank you so much.
Ma'am, it was very good, very good.
Yes.
Yes, lot of learning for us. Thank you, ma'am.
Gautam bhai, you want to say something?
Yeah, thank you very much, madam. And it was so nice to meet you after a long time, maybe video call.
Yes. Gautam bhai is a treasurer of our association, which unfortunately is not very active. But Gautam bhai, we are renewing all the FDs and all, so your money is safe. So don't worry.
Thank you very much for your assistance.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you. I hope all of you come back again for the second lot of lectures. And
Yes, we will.
Parag's lecture do attend. Okay?
For sure.
Okay. All right.
Yes,
Bye-bye.
Bye bye. God bless. See ya.
Bye.
See ya.
Bye.
All right.
Bye,
Bye.
everyone.
Bye.
thank you.
Bye, everyone.
Tada.
Yeah, bye.